It's Melissa Sweet here, public health journalist from Croakey. We're doing some walking journalism in Melbourne. I'd like to acknowledge that we're on the beautiful country of Wurundjeri people of the Kulin Nations, and we're here talking to Dr. Therese Riley, who's going to tell us about her very interesting work in prevention, working with communities. So Therese, can you tell us a bit about who you are, where you work, and some of the stuff that you've been doing?
Thanks, Melissa. I'm Therese Riley. I work at the Australian Prevention Partnership Centre and with the Sachs Institute, and we're undertaking a national initiative working in 4 communities around Australia excuse me, for chronic disease prevention.
What are the communities that you're working in?
Yeah, we're working Croakey in Tasmania, Albany in WA, Broken Hill in New South Wales, and Gold Coast in Queensland.
Would you like to tell us about one community in particular that you're working with, what you're doing there?
I can tell you perhaps about Albany in WA. We've been working with the WA Country Health Service, who are our primary partner, and we've been working with the Prevention Tracker Initiative. And what we do is work with our local partner and a local advisory group to describe the local prevention system and to work with them to guide system change efforts and also to monitor the impact of those kinds of efforts.
And can you tell us what you mean when you talk about a prevention system?
Yep.
Because that might sound like jargon, or it might sound like, what does that mean actually?
Yeah. So in a community, and quite often in public health, we invest heavily in programs. Whether that might be in smoking or healthy eating or physical activity, for example. But of course these programs are implemented in real communities. They're implemented in contexts in which there are organisations, there is a history of programs, there's a workforce, there's an environment that might enable or constrain the capacity to deliver those kinds of programs. So for us, our focus is on that context. We want to assist communities through the application of some novel methods to perhaps gain new insights into how their community operates in the context of the kind of prevention organisations and their programs, how they're connected, the kinds of issues that that community faces.
So in Western Australia, in the south where you're working, what are some of the issues that have come up in terms of the prevention system? What are some of the components?
Yep. So what we initially did in describing the prevention system was we looked at the way in which organisations involved in prevention are connected, whether they share information, whether they share resources. For example, we looked at the range of programs that are being implemented already, the kinds of topic areas that they focus on, whether they're focused on individual behaviour change, for example. We also looked at livability indicators, so how close or far away people might be from fresh and healthy food, from liquor outlets, for example, and a number of other different types of methods. And what we did was we synthesised that with local community stakeholders. We created a graphic illustration of the community and really brought some stakeholders together to look at those findings and begin to think through, well, what are the big infrastructure issues? What are the systemic problems? And by that we mean the kind of infrastructure related issues that might be really important, or problems in that system. And so for Albany, they identified engagement of more diverse people and organisations as being a real issue in their community. That if they could engage more people and organisations in prevention, increase the prevention footprint in Albany, strengthen those connections, then they're going to be better placed to address prevention efforts, no matter what that topic might be.
And can you just give us some specific examples of what are some of the factors or initiatives that contribute to prevention at that community-wide, system-wide level? I mean, are we talking about, safe footpaths and lighting, or are we talking about alcohol retail outlets, or what exactly are the types of things we're talking about?
We could be talking about all of those things, really. And I think historically the way in which we would tend to focus or address those kinds of issues in public health would be to focus on any one of those things, but quite often in isolation of everything else around them, and the context that might have created those problems or those issues. And so what we're trying to do is almost look through those very specific one-off issues to what might be going on in terms of, let me think, for example, if you were to think about liquor outlets, or no, if you think about fresh and healthy food, we might, in some rural communities, for example, it may very well be that people who don't own a car, for example, might find it harder to access fresh and healthy food because you have to drive there. And so therefore the focus might be on issues of social disadvantage, transport and car use, which might be a better way to focus on delivering those kind of outcomes than in addition to the way I guess supermarkets or food outlets might have fresh and healthy food available to people. So it's really, I think, in many ways going to the community and trying to tap into the local community knowledge about what's going on here and why, and really begin to address, I guess, some of those bigger issues that will be very specific to each community.
So can you give some examples? Just, you said you're working in 4 communities nationally. So just to give us a broad brush view of how some of the context can vary between those communities. So, perhaps to contrast and compare the issues.
Yep. We're at different stages of the project with each of the 4 communities. I think we're probably further along in the project in Albany and Glenorchy in Tasmania than in Broken Hill in New South Wales, which we're collecting a lot of data there at the moment. Each community has a very particular history, and of course Broken Hill is a mining town, has a very specific cultural history connected to that. And the nice thing I think about our project and taking a systems approach to prevention is that you need to grapple with and honour that history, because it influences all the decisions and things that might happen within a community. So I think in that, Glenorchy is a very different community in Tasmania, so the key problem that they've identified is about collaborative practice. So they have acknowledged that in order to improve prevention efforts, out across jurisdictional boundaries to address their prevention efforts. And we're yet to see what might happen in Broken Hill, but doubtless it's likely to be different again.
And how will you know it's actually had a real and lasting impact, so sustained beyond prevention tracker?
I think that's sustainability is a big issue in public health, and in many ways because it's a future event. We can create the conditions where we think sustainability is more likely, but we really don't know unless we come back in the future to see what might very well happen in that community. What we're hoping is that we're providing an opportunity for our community partners and advisory groups to think a bit differently about how they go about their work and their prevention efforts. We're trying to provide them with tools that are directly accessible to them in order to be able to think a bit differently about what's going on and to act within that. I think probably one of our mantras, and I can't remember who said this first, Melissa, but one way to go about systems thinking is to act your way into a new way of thinking. And that's why there's a very big action orientation to Prevention Tracker to enable people to act, reflect, learn, but always connected to the context in which it's operating in, because ultimately it's a system we want to change to bring about the big impacts in prevention.
And it's fantastic to move beyond one-size-fits-all mentality and approaches.
Indeed, and I guess we'll wait and see.
Thank you very much, Dr. Therese Riley from the Sachs Institute, speaking to us on Croakey Go walking journalism. Thank you.